Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Policy must be rooted in evidence produced by health promotion research.
Health equity begins with research.
Research empowers communities to thrive.
Is able to strengthen public health efforts.
Funding it means supporting informed health policy.
Investing in research means investing in the future.
It ensures that health promotion programs are effective and contextualized.
Health promotion research guides policies.
Research protects rights and well-being.
Health promotion research empowers Filipinos to live healthier lives.
It helps us become better advocates.
It guides us why we do what we do.
The future is health promotion research.
Hello, good afternoon, everyone. Thank you so much for being here. So the Health Promotion Program warmly welcomes you all to our special webinar, Together for Health Promotion, Strengthening Health Promotion Research to Advance Health Equity. This landmark event is part of HPP's second anniversary celebration and highlights the milestones we've reached through research on best practices in health promotion. We are very honored this afternoon to have an outstanding panel of speakers joining us today from the regional, national, and local levels. We hope you are just as excited as we are to learn from their insights and experiences in the next few hours. And of course, we cannot start this event without recognizing the celebration of the University of the Philippines' 117th Foundation Day. Over a century since UP's founding, the university remains true to how it was envisioned, a university for the Philippines. Before we start, we just want to remind everyone that the views and opinions expressed in this webinar are those of the speakers and do not necessarily reflect the official stance of the Health Promotion Program, its affiliates, or its partners. Furthermore, to maximize the limited amount of time that we have this afternoon together, please take note of some of the house rules for this session. First, please message any of the organizers for assistance with technical concerns. For any questions directed to the panelists, you may type these in the Q&A function. If you have any trouble finding this, again, please let one of the organizers know right away. Last, the webinar is being recorded and will be uploaded to our social media platforms. By staying in the room, you consent to having your likeness recorded. Now, we introduce our opening remarks this afternoon, and we are very honored to welcome Director Eva Cotionco de la Paz, Executive Director of the National Institutes of Health. She has provided a recorded message to kickstart our event for today. Dr. de la Paz, may we now invite you to
UP Manila
your
Chancellor,
message.
Chancellor Michael T., Dr. Dominic Maddumba, Officer in Charge, Department of Health, Health Promotions Bureau, Dr. Kathy Reyes, Lead of the National Institutes of Health, Health Promotion Program, and HPP team, colleagues, magandang hapon po sa inyong lahat. It is my pleasure to welcome all of you and to thank you for being here as we celebrate a meaningful milestone, the second anniversary of the Health Promotion Program of the UP Manila National Institutes of Health. We are grateful to be joined by colleagues from government, academia, development organizations, the research community, and civil society. Your presence reflects a shared and growing recognition that health promotion must be at the heart of how we build a healthier, more equitable future for all. This program was born out of a clear and urgent need to strengthen the science and practice of promoting health, particularly in communities that have long been underserved. Over the past 2 years, the program has made significant progress thanks to your collaboration, support, and shared vision. Our anniversary theme, Together for Health Promotion, Strengthening Health Promotion Research for Health Equity, reminds us that raising awareness is only one part of the work. Real impact requires solid evidence, inclusive policies, and action that responds to people's lives, people's realities. Research must not end in publications. It must inform decisions, shape programs, and drive change in communities that need it most. As we reflect on what we've accomplished, we also look forward. Today, we begin conversations around a bold step, the establishment of the NIH Health Promotion Research Institute, a dedicated platform to sustain innovation, inform policy, and elevate health promotion as a national policy. This is a chance to create something lasting, an institution that ensures health promotion is not just part of the conversation, but part of the solution. So today, I invite all of you to engage, ask, contribute, challenge, and collaborate. Let's shape the future of health promotion together with purpose, with evidence, and with the people we serve at the center. Muli, magandang hapon po sa inyong lahat at maraming salamat.
All right. Thank you very much, Director Eva, for the very warm opening remarks to start us off this afternoon. I think it was a very good start for us to be reminded about the work that we do, but also to welcome us as we begin this afternoon session. So given that, to begin our program, we are very honored to present our first talk of the day, which is Evidence for Impact, Charting Regional Research Priorities for Healthy Environments and Populations, to be delivered by Dr. Hiromasa Okayasu. Dr. Okayasu is a distinguished public health expert with over 20 years of experience in global health systems, strategic policy development, and multi-country program coordination. He currently serves as Director of the Division of Healthy Environments and Populations at the World Health Organization, Western Pacific Regional Office, where he leads regional efforts on non-communicable disease prevention, healthy aging, healthy settings, and the social determinants of health. Throughout his career, Dr. Okayasu has held leadership roles across WHO headquarters, regional and country offices. He has led key initiatives such as the global rollout of the inactive poliovirus vaccine and the Mekong Malaria Elimination Program. Prior to joining the WHO, he worked for McKinsey & Company, where he advised clients in the health and public sectors on innovation and strategy. We could not have a more fitting speaker to open today's session, so let's all give Dr. Okayasu a warm and virtual round of applause.
Thank you very much, Chair, for your kind introduction. So it is our great pleasure to be part of this conference talking about very important topic of research of NCD. Next, please. As we all know that Western Pacific region, including this country, is undergoing very rapid social, environmental, and demographic changes. These shifts are increasing vulnerability to health risk, especially due to aging populations, rising non-communicable diseases, climate change, and persistent inequities. Therefore, we need to make a proactive and a life course approach to health promotion. And then we particularly advocate for the transformation from a current sick system into health systems, which I'm going to elaborate a little bit later. Next, please. So as we know that NCD is a significant program in our region, and NCD burden varies quite significantly across the region. So this is the UN SDG indicator 3.4, the premature death by NCD. So this is the chance of us dying before age of 70 because of NCD. So the chances are quite varying, from as high as more than 50% in the Kiribati and then some of the Pacific countries to almost less than 10% in Korea, Japan, Australia, Singapore, and then New Zealand. And many countries are struggling to reduce this NCD burden, including these countries in Philippines, where there's very little change in chance of premature death over the last 20 years. Go to next. So as I said, that we believe that current social and then health system is actually a sick system because we are really focusing on the diseases. And the doctors and nurses are usually in the hospitals and then clinics waiting for people to be sick and then focus on the diseases and then treat the diseases and send them back to the environment which created the disease to begin with. So what we think therefore is the health systems really needs to be a health systems, meaning that we need to reach out to the healthy populations and then enroll and then screening and provide the advice so that people can stay healthy without have to coming to the hospital for diseases. And then health systems also should be the hub of the communities and then societies which create the healthy environment. And then also society needs to think about health as the core mission as part of their sustainable development, because health is critical for society and economy, and then society and economy is critical for health. So we need to create this win-win, and then health sector should be the core of this collaboration. Go to next. So then research plays a very important role. And then recently, our Director General, Dr. Tedros of World Health Organization, emphasized that we really need to understand and address the root causes of the diseases, which usually goes beyond the health systems itself. So, and research enables us to understand the root causes of the problems and then determine the best possible solution for these root causes. Go to next. And as I said, the root causes of the disease usually exist outside of the health systems. So it is very important for us to work with the different sectors, including academia, private sector, civil society, communities, and international organization, and then government. So within this, it is important to understand and quantify the problem and then diagnose the problem to understand the root causes and design intervention and deliver it, and then adapt intervention and then scale it up based on like what works. Go to next. So WHO set the NCD research agenda and then proposed the different categories. And we often do a research, which is the prevalence of diseases or prevalence of the risk factors. But we think that the research should go beyond these prevalence studies, such as the research to place NCD in a global development agenda and research on multisectoral and economic and social determinants of NCDs and their risk factors. And then translational and then health system research to scale proven cost-effective strategy globally. The last one is to research to ensure expensive but effective interventions. Go to next. So let me show a few examples to explain like what I meant or what we mean. The first is NCD in the developmental agenda. So most prominent one I remember is the investment case for NCD in these countries. So this proves that every peso invested has a return of 7 to 30 pesos by investing in key risk factors such as tobacco, alcohol, and then physical activity and then nutrition. So this was a very powerful tool when Philippines made progress in this health promotion in the past, in 2018. Go to next. Second category is multisectoral and then social determinants of NCD and risk factors. Now this is unpublished but still ongoing research collaboration between University of Philippines and an area in Indonesia. So understanding the role of determinants of health in older people's health. And then they found that whilst the health care is important to explain the health disparities amongst older adults in this country. However, it is more equally or even more important the social determinants like income and then social and human capital and healthy behavior is the 50% reasons for health disparities amongst older adults when we compare the healthy and the non-healthy adults. So that underscores our message that what we really important is not just working on improving the health systems itself, but we need to create a healthy environment to secure the income and then to have a good social connections and then human capital, and then promote the healthy behaviors for the NCD risk. Go to next. The other category is a scale-up cost-effective strategies. So this is our colleagues in the Lao country office did the pilot in the community engagement. So this is a community engagement working with the village, especially mother and then child, to co-create the solutions so that they are more willing to give birth in health centers. And then they're more likely to receive the vaccination. And there are lots of determinants other than availability of the affordable vaccine before they have vaccination and then before they have care in health centers for the delivery and then postnatal care. So as a result of this community interventions, and then it proves that it has significantly improved the vaccination and then maternal health outcome. And then we publish this as an outcome for scale up. Next, please. And the last category is expensive but effective interventions. So I got this example outside of NCD, but which was very powerful in my mind is this case study of Gavi on HPV vaccinations amongst Asia Pacific. So this has demonstrated that the HPV vaccination, while it's a bit more expensive than typical vaccine, is very effective and then cost effective, even in the low middle income country setting. And then that led to the recommendation by the Gavi, and then price negotiations agreed that HPV vaccines is available at $4.5. It's still more expensive than other vaccine, but still much more affordable comparing to other market. Go to next. So in our mind that there are few areas, remaining areas of research to be done more in this region. There are a couple just ideas to propose for the discussion. One is inequities. So we should focus more on the vulnerable groups like urban informal settlers and then rural communities, and then show the health inequity, and at the same time understand the reason behind this and then possible interventions. And second category is integration of NCD and then healthy aging. And we need more research in different countries on effectiveness of combining NCD prevention management and then healthy aging programs. The third one is climate change and then environmental health, especially in a Pacific setting, but including this country as well, to understand the impact of climate change onto the health, and then what are the possible effective interventions to it. The next category is the surveillance and then the risk factor data. So we do the surveillance in some countries. However, the frequency of data collection and then in-depth analysis or data collection on like a behavior and then disaggregated data, including, as I said, the vulnerable populations or certain age groups are missing. So we still need to understand these surveillance and then risk factors amongst those populations. And the last one is health systems and policy implementation. So there are lots of good interventions, most characterized by WHO recommendations on NCD based by policies. But there are lots of gap between like policy and an implementation. So we need more like a policy implementation research to bridge the know and then do gap by identifying bottlenecks and then scaling effective policies. So in summary, NCD is a very significant program, yet that the NCD, the investment and then including the understanding is still missing. And then we have some framework, and then we have some early success showing the power of the research. And then building on this early success, and then we advocate that the more research to be done so that we understand the root cause of the problem and then understand the effective solutions for the scale-up. I think that's it. Thank you very much. And looking forward to listening to the rest of the discussion. Thank you.
Thank you so much, Dr. Hiro. I think that your presentation really started us off so well and started off this afternoon or our session very well. The way that you described really what the initial issue will be on NCDs and how you really gave a very deep background on how this is an issue that we should be addressing and what are the ways to look at it, and how you outlined, for example, some of the research that has already been done, research in the pipeline, and how are the ways that we can really address it through different factors, not just top-down giving up and saying this is the only solution, but instead what you showed is that from the research that has currently been done, it really is a multi-sectoral approach that can be best done to address NCDs, and how now as part of the global agenda and how in the pipeline, there are even more focus areas that we should be looking at, specifically that on inequities, healthy aging, vulnerable populations. I think these, for the longest time, were not the focus of research. So I think that the highlight that you're showcasing now really underscores the importance of looking at all the different sectors, because NCDs really does affect everyone, all communities, all populations. So thank you so much for your very insightful presentation. Now we move on to our second presentation for today. So our second presentation is titled Research Guiding the Health Promotion Framework Strategy, and this will be delivered by Dr. Dominic Maddumba. Dr. Dominic Meng A. Maddumba is a public health physician with expertise in health promotion, health systems management, and social and behavioral change. He holds a Doctor of Medicine from St. Louis University of the Philippines, a Master in Public Management and Health Systems Development from the Development Academy of the Philippines, a Master of Public Health from the University of Sheffield School of Medicine from the United Kingdom, and a Master of Public Health, major in Health Economics from Jagiellonian University College of Medicine, Poland. Dr. Maddumba currently serves as the Officer in Charge Director 3 of the Department of Health, Health Promotion Bureau, and is also a faculty member in Strategic Communication in Health Governance at the Development Academy of the Philippines. His work centers on advancing social and behavioral change, translational health, and strengthening health systems to enable impactful and sustainable public health initiatives. Please join me in giving a warm virtual round of applause for Dr. Meng Maddumba's recorded message.
Isang mapagpalang hapon po sa ating lahat. On behalf of our Director 4 of the Health Promotion Bureau, Director Tina Marasigan, I am Dr. Dominic Maddumba, OIC Director 3, and I will be presenting the Health Promotion Framework Strategy of the Health Promotion Bureau. So today we proudly celebrate the second anniversary of the Health Promotion Program under the UP Manila National Institutes of Health with the theme Together for Health Promotion, Strengthening Evidence and Action for Health Equity. On this milestone, the Department of Health through the Health Promotion Bureau extends its warmest congratulations to the Health Promotion Program for its invaluable support in advancing health promotion research. Your work has significantly contributed to the department's effort in fostering a healthier and more empowered population. We are excited for what lies ahead, particularly the establishment of the Institute of Health Promotion Research at UPM-NIH. This initiative will be instrumental in deepening our commitment to evidence-based policymaking and action, ensuring that health promotion in the Philippines remains equitable, data-driven, and responsive to the needs of all communities. Following the regional perspective on health promotion research in the Western Pacific shared by Dr. Hiromasa Okayasu, I will now provide a brief overview of the Health Promotion Framework Strategy, or HPFS. This strategy offers a comprehensive guide for advancing health promotion in the Philippines, grounded in its legal foundations and strengthened by evidence generated through our partnership with the UP Manila National Institutes of Health. First, let's begin with the legal basis for health promotion in the Philippines. Pursuant to Section 30 of the Republic Act Number 11223, or Universal Healthcare Law, and its implementing rules and regulations, the Department of Health is mandated to scale up its health promotion and develop the Health Promotion Framework Strategy. Further, not only shall this be implemented at the national level, but it shall also be strengthened at the local level. Provided that the health system is devolved here in the Philippines, it is very crucial that LGUs are aware that they are also mandated to enact stricter ordinances that strengthen and broaden existing health policies to implement effective programs that promote health literacy and healthy lifestyle. All of these, of course, to improve health population factors such as tobacco and alcohol use, address mental health, and others that will be also addressed by the HPFS. Likewise, with the establishment of the Health Promotion Bureau pursuant to Section 30 of the UHC Act, the expanded functions of the HPB also included supporting research and development on priority areas identified in the HPFS, and doing evidence-informed sectoral policy and planning for UHC and our health impact assessment. Now, what is the Health Promotion Framework Strategy? First, we always emphasize that health for all begins with health promotion. And what makes us healthy? What makes you healthy? While healthcare services are essential, they only account for about 20% of what determines a person's health. The bigger influences lie beyond the hospital walls. Socioeconomic factors such as income, education, and employment contribute 40%. Health behaviors like diet, physical activity, and substance use make up 30%. And the physical environment, including access to clean water and safe housing, accounts for 10%. These broader determinants play a very critical role in shaping the overall health of every Filipino. Ensuring healthcare means providing the support Filipinos need when they get sick. But also addressing the social determinants of health goes even further. It means protecting Filipinos from getting sick in the first place and empowering them to care for themselves, their families, and their communities. Addressing the 20% that healthcare services represent requires a whole-of-system approach, strengthening our health systems, workforce, and service delivery. But the remaining 80%, the social, behavioral, and environmental determinants of health, demands a true multi-sectoral collaboration. This includes the vital contributions of government, civil society, the private sector, and especially the academe and research community who generate evidence, shape policy, and drive innovation to create healthier environments and more equitable opportunities for all. Health promotion is more than health communication. It is by focusing on the broader and more impactful strategy on community engagement to drive behavioral changes. Let us also put into account that health promotion is creating healthy environments. While communication and education are very crucial in informing individuals about how to be healthy, to create an environment that supports and reinforces positive behaviors on a communal level. Health promotion is also involving communities to create healthy environments. Collaborative approach enhances the relevance and accessibility of health interventions and leverages on social networks and local resources to sustain long-term behavior change and improve overall health outcomes. And finally, health promotion is empowering communities empower themselves. So when we involve our community members in identifying needs, developing their own solutions, and implementing strategies, health promotion fosters a collective sense of ownership and empowerment. Guided by this principle, the Promotion Bureau developed the Health Promotion Framework Strategies, which sets the overall direction, strategic priorities, and implementation approaches, programs and activities for the period of 2021 to 2030. We develop a strategic framework that centers on key action areas and national health priorities, guided by inclusive and equity-driven implementation approaches. This framework is designed to advance the DOH's goal of promoting wellness and enabling healthier lives for all Filipinos. Through our partnership with the Health Promotion Program, we support research tailored to various settings and life stages, focusing on the 7 national priority areas for health promotion. These 7 priority areas are diet and exercise or physical activity, environmental health, immunization, substance use including tobacco health, sexual and reproductive health, and violence and injury prevention. Our key strategies are anchored on healthy governance, healthy settings, and health literacy. Healthy governance ensures that health is integrated into all policies and that leaders across sectors are accountable for promoting health and well-being. Healthy settings create supportive environments such as schools, workplaces, and communities where health can thrive. And health literacy empowers individuals with the knowledge, skills, and confidence to make informed decisions about their health and to actively participate in improving the health of their families and communities. These priority areas are also reflected in the Philippines National Unified Health Research Agenda 2023 to 2028, which includes a dedicated theme on health promotion. These themes governance, healthy settings, health literacy, communication and education, as well as innovative approaches to health promotion and education. With the Department of Health, the medium-term research agenda also highlights a dedicated section on health promotion, communication, and education. This section covers critical areas such as health literacy and behavior, health in all policy, and health impact assessment, particularly under the component on assessment and evaluation. At the national level, the Health Promotion Bureau develops its internal policy, comprehensive review of existing frameworks, identify gaps, whether legal, policy-related, or knowledge-based, are prioritized accordingly. Health policy and systems research conducted in partnership with UP Manila National Institutes of Health plays a vital role in informing and supporting these agendas. This collaboration strengthens our capacity to advocate for health-promoting policies and programs with key decision-makers across the country. At the local level, we actively promote the implementation Research, or PAR, guided by DOH Administrative Order Number 2021-0065. This approach allows us to, number one, provide sustained support for local research and development. Number two, cultivate a growing community of PAR practitioners across the country. And number three, strengthen collaboration among practitioners and research institutions through our established research consortia. Ultimately, our goal is to mobilize more partners in research to drive evidence-based, community-rooted health promotion interventions, ensuring that every locality is equipped to respond to its unique health challenges with locally generated solutions. As we remember a critical truth, only 20% of what makes us healthy lies within the healthcare system. The remaining 80%, our living conditions, income, education, behaviors, and environment, are shaped outside hospital walls. And because these factors are shaped outside the health sector, no single institution can address them alone. We need multi-sectoral collaboration, a united effort where health is everyone's business. This means working hand in hand with the education sector to nurture health literacy, with the transport and housing sectors to build safe environments, with labor and social protective agencies to create equitable opportunities, and with the private sector to innovate, generate evidence, and amplify what works. Together, with your support in health promotion research, let's make healthy behaviors the easier choice for everyone, everywhere, every time. Muli, mula po sa Health Promotion Program, isang mapagpalang hapon at congratulations po sa ating Health Promotion Program of UPM NIH. Maraming salamat po and thank you.
All right, thank you so much, Dr. Meng. I think with our second speaker today, we can really see that there's a theme coming across from both our speakers, which is really the emphasis on a multi-sectoral approach to address a lot of the health issues that we're facing, whether in a community level, on an individual level, family level. And you can see that the focus is very much strengthened by research. With our first speaker, they show the focus areas, and now we also see further focus on what are the key issues that definitely need a lot more information for us to be able to get data and create more equitable policies. I think one really important thing that we found or we learned from Doc Meng's presentation now is that we need locally generated information to create locally generated interventions, because these are really the ways that we can create successful and long-term interventions that are tailor-fit to the different community issues that we have. So thank you so much. So last but not the least, we will now dive into the best practices of local health promotion intervention and the research that guides them and experiences on implementation. Known internationally for their great results, we'll get to know the heart of the Healthy Hearts program from Dr. Christian Bondoc. Dr. Christian Earvin D. Bondoc is a physician, public health manager, and health professions educator. He currently serves as the Municipal Health Officer of Igbaras, Iloilo, and is a senior lecturer at the University of the Philippines, Visayas. A founding member of the Philippine Society of Public Health Physicians, Dr. Bondoc has actively led local health initiatives, including community-based cardiovascular risk screening and elderly health assessments. He is also completing his Master in Health Professions Education at the University of the Philippines, Manila, with a research focus on strengthening primary care and family medicine for universal health care. So let us welcome to the floor Dr. Bondoc.
Good afternoon, everyone. Can I have a quick audio check from the tech team? If I'm audible?
Yes, po. We can hear you, po.
All right. Permission to stop share my video lang since the signal has been unstable the past hours.
Of course, po. No problem, po.
All right. Thank you very much again to the UPNIH Health Promotion Program for giving us the opportunity today to share our experience with the Healthy Hearts program and how research has been instrumental in guiding our decisions as we transition to sustainability. So here is an overview of what I will be discussing this afternoon. And we first go to, is the slide on the Healthy Arts program showing?
The title slide po is showing.
All right. Maybe I can just ask help from the tech team na lang. I'll just signal when to change. All right. So we can proceed to the content slide. The slide prior. All right. So we go first to understand what the Healthy Arts program is, or as we call it here during implementation, the HHP. So HHP is a joint initiative by the World Health Organization and the Department of Health in partnership with Resolve to Save Lives, and it was aimed at improving cardiovascular health and reducing mortality from NCDs or non-communicable diseases such as heart disease, cancer, and diabetes. It focuses on strengthening local health systems to provide better healthcare for individuals and communities, particularly in managing hypertension and promoting healthy lifestyles. In the Philippines, HHP was piloted in Iloilo province, particularly in the 1st Congressional District from 2021 to 2022, and it later on expanded to include the other municipalities in Iloilo and eventually the entire Western Visayas region. Next slide, please. Next slide. So HHP is focused on three main goals. First is improving hypertension control by targeting a blood pressure control rate of 80% or better. Next is preventing complications such as cardiovascular disease and diabetes, and reducing premature mortality from CVDs. Next slide, please. So the program involved training healthcare workers, providing them with tools like the Healthy Hearts Technical Package and the Hypertension e-Registry, and engaging communities to promote healthier lifestyles. Here in the picture, we see the barangay health worker representatives from the 7 municipalities in District 1 in Iloilo Province, showing their pledge to helping beat NCDs in their communities during the World Heart Day celebration last September 2022. As we will later on realize, the BHWs played a big role in the implementation of the Healthy Hearts program. Next slide. So before we go into the details of HHP implementation in our municipality, allow me first to introduce our humble town. Igbaras, one of the 7 municipalities in the 1st District of Iloilo, has recently been reclassified as a second income class municipality with a projected population of about 32,000 for 2025. Our town is composed of 46 barangays, with 6 being considered as geographically isolated and disadvantaged areas or GIDAs. Next slide, please. Our local leaders are Mayor Vicente Escorpion Jr. and Vice Mayor Sherwin Paul Kidato, who were both re-elected for their second term during the recent midterm elections. I, on the other hand, have served as Municipal Health Officer since 2022 after my stint as a doctor to the barrio. Next slide. We have a lone rural health unit with 7 barangay health stations acting as catchment areas of the other barangays. And manning these facilities are a total of 2 doctors, 1 dentist, 7 nurses, 12 midwives, a pharmacist deployed by DOH, and 255 unwavering and dedicated barangay health workers. Next slide. Here are some of the key interventions of HHP during its pilot implementation in Igbaras. So there was a conduct of a workshop on formulating a local ordinance on hypertension clubs. The program also assisted us in the initial accreditation for PhilHealth's Consulta package. Next slide. It also involved deployment of the hypertension e-registry and the portable hypertension reporting tool, sourcing out of antihypertensive medications with note of no stock out all throughout implementation, the provision of a total of 187 digital BP monitoring devices for BHWs. Next. And the capacitation of the health workforce through an e-learning course medicine forecasting, and the provision of job aids in the form of flip charts, posters, tabletop guides for the BHWs. Next slide. This slide just shows us some action pictures, including how we integrated risk assessment during COVID-related activities and during our home visits at the peak of the pandemic. At the same time, you can also see monitoring visits from the team composed of the WHO, the DOH, and the Iloilo Provincial Health Office. Next slide. During the pilot implementation, we saw a service coverage of 26.3% for the first year. Next slide. With 2/3 of patients having blood pressure within normal. Next slide. And the remaining 1/3 with uncontrolled BP despite being on medications. Next slide. Now that we have a background of what happened in the earlier years of implementing the HHP, we briefly talk about our study. So we conducted a cross-sectional study last 2023, which focused on risk assessment using the PhilPen, or the Philippine Package of Essential Non-Communicable Diseases tool within the municipality. Next slide. Findings from almost 600 participants recruited in the study showed that 41.6%, or about 2 in 5 individuals, presented with elevated blood pressure levels. This is alarming as 1, these individuals were not known or diagnosed hypertensives, and 2, our study estimated an elevated BP to have a 14.2 times greater CVD risk. Other significantly associated risk factors were diabetes, smoking, hypertension, and even having a relative or family member with hypertension. Altogether, these findings call for the expansion of risk assessment services in Igbaras. This could be achieved by institutionalizing a regular schedule for CVD risk assessment, recruiting and training community volunteers to augment the already heavily worked barangay health workers, and providing logistics to execute risk assessment activities. This could be coupled with efforts to monitor those known to be hypertensive and diabetic, and strengthening the smoking cessation program in the different barangays. Next slide. While the findings were already initially used to lobby for changes within the NCD program of the municipality, additional traction was gained when our study was privileged to be presented during the 3-minute pitch to policymakers sponsored by the Philippine National Health Research System last August 2024. Next slide. This served as an avenue for us to present how our study can be used to effect policies within the municipality. Next slide. With that, we discussed the actions that were taken following the results of the study. The first recommendation focused on expanding the risk assessment services within Igbaras, which was materialized through capacity building of the barangay health workers on the updated PhilPen assessment tool and the initiation of risk assessment at the barangay level. Next slide. For the second recommendation, opportunistic screening during outpatient consultation and some local activities is still being done. A good opportunity for our locality is the partnership with the West Visayas State University, both the College of Medicine and the University Medical Center, which deploys clinical clerks and postgraduate interns who augment in the risk assessment activities during their community rotation. Next slide. Because of these efforts, from an initial 26.3% coverage, service coverage has been increasing over the past years with the latest coverage of 54.4%. Next slide. The third recommendation touches on the strengthening the monitoring of hypertensive and diabetic patients within the municipality. One of the challenges we have encountered is the inconsistent follow-up of our patients, which, based on experience, is largely dependent on the availability of antihypertensive medications. With this, an increase in the budget for drugs and medicines was needed. Next slide. The use of the data from our study reaped results as seen in the graph, wherein our annual budget for medicines used to be fixed at 600,000. With the increased awareness of the need to invest in NCDs, especially hypertension, we saw an increase in our budget from 1 million for 2023 and 2024 to 2 million for this year. Next slide. This increased investment likewise translated to results, as we saw an increase in the proportion of hypertensive individuals with controlled blood pressure, our latest being 76.8%. Next slide. Lastly, the recommendation to strengthen smoking cessation efforts in the municipality is still something we could work on, although a comprehensive smoke-free ordinance is already in place since 2021. Next slide. From pilot implementation up until now, we see how the first district was able to accomplish this feat, hitting the target 80% BP control rate, and how research can help in informing our actions in the field. Next slide. As we move forward, some of the activities the local government could undertake include the final review of the NCD Club Ordinance, lobbying for increased investment for NCDs, including maximizing the PhilHealth Consulta package, and following the latest version of the medicine forecasting tool, incorporating risk assessment in the electronic medical record system, monitoring the performance of health workers, especially since accomplishments vary across the different catchment areas, and evaluating NCD outcomes. Next slide. With the success of the HHP, there are now talks to incorporate diabetes in the expanded protocol. We also could capitalize on the opportunities that present, including partnership with the private sector, through the involvement of medical practitioners in identifying adults at risk, and potential outsourcing to private pharmacies, and continuing our engagement with our academic partners. Lastly, the greatest insight I can probably share is that our experience in primary care is rich, and as such, we should be proactive in pushing for the research agenda with DOH. Next slide. To this day, research remains as an acquired taste for many, but I hope someday, with the undeniable role of evidence-informed decision-making, we become part of creating awareness and appreciation for research in our circles. I hope this presentation has been worth your time, and I look forward to a fruitful discussion. The next slide will show a list of my article references. Thank you very much for your kind attention.
All right. Thank you so much for that presentation, Dr. Bondoc. I think your presentation really is an inspiration in terms of really talking about how there is a real life example of how research was able to affect positive change in your community, and now how to scale it up with all the wonderful recommendations you were able to show. I think you were really able to show or capture how evidence-based solutions and actions through research can really lead to success. And the presentation was able to really show that multi-sectoral partnerships were also effective in really making that happen. When you talked about working with the academe, the communities, the local government, and exploring furthermore with private partnerships potentially in the future, I think it really ties together all actually of the presentations that we've had today and this afternoon. So with that, I want to thank all the speakers for their wonderful presentations. I know I speak for everyone here today when I say that all the presentations really serve a testament to the significant benefits of health promotion research. With that, we're now moving on to our open forum where our participants will get to ask questions to our speakers. So for our speakers, I kindly invite you, if you're able to please open your camera again, so that we can put a face to the name when we have our open forum. So I invite again Dr. Hiro, Dr. Bondoc, and as a proxy for Dr. Meng, we have with us Ms. Andrea Oracorachea from the DOH Health Promotion Bureau, who will be joining us for this open forum. Now, for everyone in the Zoom, please use the Q&A function if you have not yet typed your burning question that you want to ask. This is your opportunity to do so. And for those watching us through our live stream, please feel free to comment, and one of our team will take note of the question that you have written down, and we will then give it to our speakers for them to be able to answer when they are able to. So I think we can start with our questions. So the first question that we have is, given the current shifts in the global health landscape, what do you see as the most significant challenge in supporting research and evidence-informed interventions in health promotion? Furthermore, how can countries ensure that research remains equitable and responsive to community needs? And what role do global health institutions play in ensuring equitable knowledge generation? I think I'll definitely ask Dr. Hiro to take that question. Dr. Hiro?
Yes, thank you very much. So first of all, as we all know, the landscape for global health is changing right now. For us, that the United States is withdrawing the WHO, and then other organization is reconsidering the priorities. And then our concern is like global health is not only neglected, but also like NCD and then health promotion is deprioritized. Because unlike some other priorities, like if we don't do anything, people don't die today for NCD. And then unfortunately, that's what happened during the COVID-19 time. So we focus so much on the response to the COVID and then immunization. So many of the NCD care and then management and then prevention were neglected. So I hope that this won't be repeated. And then furthermore, the research comparing to the immediate interventions tend to be neglected because, okay, granted that NCD management, we don't do anything today, probably don't die, but still we need to give a medicine to diabetes or hypertension patients. But if we don't do anything for the research, or if we don't do anything for the health enabling policies like tobacco, alcohol, nutrition today, probably some may feel that we don't die today either. So it is very important that to recognize that investment for the future, such as research and the knowledge generation, as a priority. And then we need to balance, even if we have a limited resource for the short term and then longer term priorities. And the second part of the question is, it is very important to be equitable and then consistent with local needs. This is also what WHO is proposing, because it's very important to make sure that each community, each member states do a research, as the chair, you pointed out, so that the most suitable policy is adopted in each situation. And again, WHO is advocating this and then working with the government and then a partner like yourself to make sure that the research is addressing the local needs and the situation. Thank you.
All right, thank you so much, Dr. Hiro. I definitely agree with you in terms of the significant challenge. I think that that's also something that we experience here in the research sector when COVID hit. NCDs really were neglected because the shift changed. And now with the shifting global landscape, we have new challenges. So it really must be an effort to continue to push forward the agenda on prioritizing NCDs, because these are really what are affecting large communities all throughout. So I think that that is a very timely focus that we need to look at. So thank you so much for that. Next question, I think, from FDA PPS 4th Flora. The question was, most, if not all, health promotion research involves human participants and therefore requires ethics approval. However, health departments or offices in most local government units do not have their own research ethics committees, which highlights the need for external ethics review. So this question is asking, what assistance can the DOH or the HPP provide to support LGUs in pursuing such research? Maybe this one I'll give to Miss Andrea, Ma'am Andrea.
Thank you. Good afternoon. For that question, we usually in the Health Promotion Bureau receive requests asking us to endorse a particular study to the SJREB for its clearance, and we do extend that help to researchers. But also, if the question is more on the local government unit or my specific community lang where the research will be conducted, it's either that that you connect with us, then we refer you to our health research division, which is in another bureau, or you may coordinate with your centers for health development, and so they can refer you to ano ba yung mga health facilities, hospitals na meron sa region nyo that accredited yung mga ethics review board. So maybe mas madali yun if you will coordinate with your centers for health development, or you can also opt to email us, write us, and we will facilitate it. Thank you.
Okay, thank you po, Ms. Andrea. So I think that that's a very good question because I think a lot of communities, for example, they want to do research, but ethics can seem so daunting and they don't know what to do. What is the next step? But it's required to have ethics approval. So I think Ms. Andrea was able to help direct us better at this by really telling us that, just ask. Email them to see what are the next steps. I mean, I think Dr. Maddumba's presentation really showcased earlier that one of the main directives that they're also really looking at is how do they support LGUs in terms of doing the research themselves. And I think that this is one way of helping because ethics can be quite a big step in the ethics approval process. All right, so our next question is from Billy Morga. And the question is, the usual comment I hear is that there's no time to do research. How do you see formative research fitting in the program and budget cycle? So I think that this question can go to Dr. Bondoc in terms of everything that, with all the priorities in your role. How is there time to do research with all the other priorities that local communities face?
I agree. Much of the hesitation really is because that as public health physicians, especially those in government service, we already have a lot on our plate. So it really takes effort for us to engage in research. In my case, I think one of the key factors really was the engagement with the academia. So we have partnerships with University of the Philippines as well as the West
Doc
Visayas State
Bondoc, I'm so
University.
sorry, you're very choppy right now. If it would be easier to turn off your camera, if ever.
Is my audio better now?
Hello, Doc. Confirming that it's okay po. We can hear you. You can
Yes.
proceed po, Doc. Thank
Go
you.
ahead po. I was the one who got cut off. I'm so sorry. Go ahead po, Doc.
All right. So is this okay now? So what I was saying is it really takes a lot of probably balancing time because we already have a lot on our plates. And what has worked, as seen in my presentation, what has worked for us here is our academic partnerships, and we get to engage in research because the students are actually deployed. So it also helps us identify potential gaps with all the challenges that we have in health. So with the I think with UHC now, there are a lot already of, for example, medical schools in the state universities. And I think that can be an opportunity for us to engage the primary care primary care doctors or the primary care system, and that's where the recommendation to push for the research agenda also comes from. So baka pwede, no, that the state universities with the new medical schools can tap partnerships with the rural health units. So as we also, I think that will also answer the question on equitable research. We also make sure that these areas which might not be represented could be tapped or could be involved in the conversation.
All right, thank you so much, Dr. Bondoc. Again, apologies. It was me pala who got cut off. I didn't notice. But yes, I was able to capture your answer po, and I think that that's something that you also discussed earlier in your presentation as well. That, you know, of course, with many different priorities, the key really for this research is to look into a multi-sectoral approach. And one that you really highlighted with your answer now, universities, you know, there's a lot of researchers in different universities who would be happy and willing to help to do the research really and work together with communities. And I think that you were able as well to show an effective example of that being done. So our next question is for Dr. Hiro. How can we ensure that in conducting research involving human participants, that we do not reduce individuals to mere instruments for achieving academic or institutional goals? In what ways can we safeguard against extractive practices and instead promote research that is ethical, participatory, and grounded in respect for the dignity, autonomy, and well-being of the communities we engage?
Thank you very much. I think that's an important topic. And then this is a program in a global setting. And then some countries says that they are contributing to the research of the global goods, but there is no benefit coming back to the community or countries. Or sometimes industries exploit the local knowledge of like herbal medicine or traditional medicine and then make it to the business. But there is no benefit coming back to the countries or the local cultures as well. So while we advocate that more research to be done at the local level and especially around the vulnerable population, I think it is important that this research should benefit the local community. So there are a few important points. The one is like it is important that there is an input from this community and ideally co-designing, as we saw in the case of the Lao PDR's Connect study. And then also like make sure that there is a consent of people who's participating in the research, making sure that they understand. Also, our type of research is not very invasive usually, but if it is a case, then explanation is very important. And then in research implementation, planning and implementation, I think it's important to include the community members and then make sure that the feedback mechanism is embedded. So these are the points that usually WHO Ethics Review Committee, when we support the research, asks, but are fully informed and then fully benefited from the research that.
Thank you so much, Dr. Hiro, for that response. I think you're able to capture very well what is the important way to move forward when it comes to research, which is really when we partner with communities to ensure that they really are partners and honoring that partnership by having them be with you every step of the way, consulting with them, and really working with them all throughout the end of it with, as you mentioned, even with a feedback loop at the end, just to really showcase the importance of how this research is for benefiting the local community, that the research is heavily valued, and that the benefits will eventually go back to them as well. Our next question is with regard to the implementation of tariffication measures affecting health supplies globally. What role should health advocates play in addressing this growing concern and mitigating its impact on healthcare delivery and outcomes? Maybe Ms. Andrea again, I could ask you to take that question.
Thank you. So maybe the question refers to the yung mga stockouts ng health commodities that we're experiencing now, I say that health advocates play a critical role in terms of providing feedback, not only to the national government agency, not only to the Department of Health, but as well as other government agencies that could help. Like, depending on ano yung nakikita na lang, depending on what specific commodities you're referring to or what specific health services that you're referring to that is being affected by the tarification measures, your role as health advocates in providing feedback to those who are sitting in policy decision-making level at the national government level could help shape policies moving forward. And also, it could start up the interagency discussion in terms of how we move forward to address these issues, because it concerns not just the health sector, but as well as the other government agencies, as well as the private sector. So maybe that's what I can provide for now. But if you have a more specific questions, if you have a more specific health service or health commodities that you would want us to provide specific details on, we can share that with you, or we can share with you what the department is going or doing to address these issues. Thank you.
All right, thank you po, Miss Andrea. I think it's very fair to say that it really would depend on the specific commodity. You're right that yes, there are tarification on health supplies globally, but with each supply, they're very different. Even who we tap in terms of procuring, getting these supplies will definitely be different and will be based on discussions with different agencies. So, of course, it will just really depend on that. But it is great to hear coming from the DOH HPB that it's really a matter of reaching out again to you or to your to the bureau and asking really what exactly is being talked about here. So we now move on to our last question for today. And this last question we will ask to Doc Bondoc, which is that given that we've learned the many benefits of health promotion research through all the speakers today, to the real-world example of the Healthy Hearts program, how then can we advocate for its support and funding, especially at the local level?
I'll just turn off my video again just in case it becomes
Ano
unstable.
po, it's okay. I think it was mine po talaga. Go ahead.
Yeah, so
Apologize.
I think I already mentioned it in one of the replies that I sent. Aside, of course, from the usual processes that we go through, one thing that I noticed was really to align also our research focus to the priorities, to our health priorities. Kasi in our example, NCD did not really gain much attention before, but because of the findings na there was a very high prevalence, and then we were actually the data that I shown, we were missing 2 in 5 who were potentially hypertensive, but they were never reached because they were never screened. And then we present all the data from the secondary data from researches, published journals. We present it to our local chief executive and try to make them understand why giving attention to NCDs is important. And eventually, when they grasp the importance, that's when they transition eventually to giving more budget, supporting the research activities. Because up until now, we do get students who are deployed in our area, and every time we lobby for activities related to the research, our local chief executive will be very supportive. And I think it's also one thing, since we're already talking about the local level, it was also a great help that our mayor is a graduate of the leadership and governance program that was conducted by another foundation before, because now our mayor gets to understand his role in the health arena. So dati kasi 'di ba, when we talk about health, nasa doktor always ang burden to answer that problem. But now when you understand that it's a bigger system that we are moving in, and kasama ang governance doon as an essential building block, then we create also buy-in for that. So yun po, we make sure that our mayors understand our language, so simplifying all these jargon. At the same time, we align it also to the local priorities para we have a higher chance of gaining support from them. Yun po. Thank you very much. Over to you.
All right, thank you, Dr. Bondoc. I think you really highlighted again the importance of working with local communities, knowing really what the issues they care about. And I think that's something that a lot of our speakers also talked about today by talking about the research focus or the priority areas. You can really see the direction in terms of what are the focus and how can you fit in potential topics or research that you want to possibly explore. And I think also a good suggestion is when you talked about how do we then translate this research into something that can be understood beyond very scientific terms, because that's really how you're going to get people on board with what you want to research more on, which is them understanding the importance of this. Because sometimes when they look at all the scientific figures, they'll just be like, I don't know what to do with this. So I think that you're right in terms of really having that be put in more tangible, easily understood language that aligns with the priorities. And that's how we can ensure funding. So thank you again to all the speakers for their wonderful presentations and being part of today's engaging session. I know we have a lot of more questions actually at the Q&A box. And for sure, we will be giving those questions to our speakers. But unfortunately, for the open forum, we had to close for now. But thank you again for being part of today's engaging session. As we near the end of our program, we are very grateful for the meaningful insights shared by all of our speakers today. So with that, it is my pleasure then to welcome to the floor Dr. Catherine Ann Reyes, a research assistant professor and program lead of the Health Promotion Program, to deliver our closing remarks this afternoon.
Right, thank you, Steph, for that. Again, good afternoon to everyone. And as we draw to a close, after all of this insightful discussion, I want to extend my gratitude for everyone's active participation. I actually really enjoyed the presentations, as well as learned also from the questions that were raised. So it gives us an understanding of what people are, the role in this research ecosystem. So we have covered important ground this afternoon, and I hope that we have gained some insights that connects with what we are doing on a day-to-day basis. So we are primarily a research institution, but we are happily connected with this ecosystem, those who will need to do research, those who will need to use research in their work. One of our objectives for this webinar was to raise awareness about the importance of doing research in health promotion. And I took note of the presentation by Dr. Hiro, giving us that perspective from the regional level and where Philippines belong. Wherein he highlighted that research can really help unpack critical questions, so difficult questions around complex items like inequity, integration, like how do we maximize resources and improve on our outcome by looking into effective integration. Also unpacking the complex nature of intersections like climate, environment, and ensuring that we are working on recent current data to guide our action, right? Because how we cannot upgrade, we cannot update if we are behind with our data and with our information. And I also really resonate with what he pointed out as a critical role of research, which is not to settle with developing or generating the study, but really looking into the know-do gap and the scale-up gap. So whenever we do our research, we need to have this in mind. How do we cross the evidence towards action, and how do we generate evidence to give us an idea when it is ready for scale-up for benefit of the larger population? We also welcome the commitment of the Department of Health to really support evidence generation, so that our policies, as Dr. Meng mentioned, equitable, data-driven, and responsive. And while currently this is manifested by their support in the health promotion program, the soon-to-be Health Promotion Research Institute, we actually look at this platform as a mechanism to collaborate with other researchers, to open the space where we can work with other like-minded people interested to strengthen our preventive and promotive interventions in the country. So our doors are open to think about and to talk about how we can maximize the support from government, and also utilize this as a mechanism to strengthen other research initiatives in our partners, state universities, other independent researchers, and other advocates who are really wanting to make change, in the space of prevention and promotion. We are also inspired, Dr. Bondoc, so Dr. Christian, with what you've shown us as possible. We see a very practical way of really elevating what is research. It's not just a fancy name, it's not a fancy exercise, but it's really there to change lives. And maybe linking this to what's happening now. Dr. Hiro earlier started with a context that we are facing a very changed world. And I think increasingly the role of making our action together as a community being relevant to what the country needs, I think it's more important than ever. So as we strengthen our research knowledge ecosystem guiding our policies, we are also very keen in connecting with the global health community so that we continue to really learn from each other. So we are interested to continue this conversation. We hope this is not the last. And as we think and as ideas come to mind for us to collaborate, I hope that we can continue and sustain the connections made this afternoon. So let us continue to promote critical thinking, evidence generation that will inform our policy. So again, thank you so much. Thank you for this space that we created, and we look forward to more discussion, but more importantly, more actions in health promotion and prevention that will save lives. Thank you.
All right, thank you so much, Doc Kathy. Now we invite everyone to answer our event's evaluation form. This can be accessed through the QR code shown on your screen and through the link messaged by our organizers. Your response will help us plan future events of the UP Manila NIH Health Promotion Program, and you may answer this evaluation form by 5 p.m. today. Answering this is also a prerequisite to receiving your certificate of attendance to today's webinar. As we screen and validate the responses, we appreciate your patience in receiving the certificates. Rest assured, as long as you registered, attended via Zoom, and answered the evaluation form as instructed, you will receive your certificate to your registered email address. So please just be patient with it. But as long as you did all the steps, attended, and answered the form, you will get the certificate po, after this webinar. It just might not be by this afternoon po. So please, your patience on that. So that concludes our event for today. So to stay updated on the latest happenings of the health promotion program, please follow our social media pages shown on screen and sign up to our newsletter by scanning the QR code. We hope to see you in all our future events. So please sign up if you